Kids Health Watch with Dr. Sang is sponsored by Sang Pediatrics.
Every month we focus on children's health with local pediatrician Dr. Nu Sang from Sang Pediatrics in Fresno. Dr. Sang, thanks for joining us.
Thank you, Kim.
We are talking about something very important that is happening sadly in a lot of people's homes this morning or throughout this season, and that is fevers.
Yeah, that's right.
Medically, what is considered to be a fever?
Well, fever by definition is a temperature over 100.4 degrees Fahrenheit. So like we always say like, oh, he has a low-grade fever and it's like 99. Well, actually 99 doesn't really count.
Okay.
So I just wanted to go on the program because there's a lot of talk now and a lot of fear about fever, especially during this season. So I wanted to clear up some misconceptions.
Okay, so 104, that's very scary.
Oh, 100
I'm sorry.
yeah, so that's the thing.
Oh,
100.4.
Okay,
There you
gotcha.
go.
All right.
So a little bit less than
what
101.
causes a child to have a fever?
There's many causes of fever, and everyone's always afraid that a fever is an indication of an infection, and that could be true, you know, and certain infections require antibiotics. Those are the bacterial kind, and that's very common. But even more common than bacterial infections are viral infections, and these do not require antibiotics. And most of the time, these viral infections will clear out through the body by themselves. And so we as pediatricians, we as healthcare providers want to examine the patient before we start prescribing antibiotics, because we want to make sure that that is the right treatment for that infection.
We also showed that sometimes it's just teething. The body is going through something.
Yeah, so inflammation can be caused by many things, including teething, and so that's why I want the viewers to know that sometimes they can treat it themselves, but they want to bring the patient in, they want to bring their kid in to us so that we can examine them and make sure that it's not something more serious.
Okay.
So that's why actually in Sang Pediatrics we have a walk-in policy, whereas before 11 a.m. in the morning and before 4 p.m. in the afternoon, if your child is sick, you can come into our clinic and we'll examine the patient and determine that for you.
Oh, wow.
Because we want to keep children out of unnecessary places like urgent cares or ERs where they can get more infected. And we also know the patient already, so we don't have to retake all the history and things.
All right,
like
that's
that.
a good point. All right. Now, we said some origins. Is there an unknown origin that could cause a fever as well?
Actually, in the medical books, what the common most people don't know is that there's a diagnosis called fever of unknown origin, and when you have a fever of unknown origin, it can last 2 weeks, and that's okay. Fever can last 2 weeks, and your child's not going to die. And we don't always have to do medical tests such as blood tests or imaging for the patient in order to make that diagnosis. But sometimes we start doing it because the parents are so anxious.
Yes.
And so we understand that. Okay. But medically, you don't have to do anything for almost 2 weeks before we start doing things like that and start looking for. It's a very long 2 weeks. Yeah, looking for things, rare things like cancer.
Okay.
Yeah.
How do you treat this variety of fevers?
Yeah, so we've had a shortage on medications in the United States. Tylenol and Motrin and Advil have left the shelves. Yeah. So you can just unwrap the baby, just wear loose clothing, take a sponge bath, take a lukewarm bath, things like that. But if you do give medications, please give the right dose. Some people are thinking, hey, I got to give more to make it go down faster. It doesn't work that way. You can overdose on Tylenol even. So the doses of Tylenol and Motrin, if you need help, you can, it says on the box there, call your doctor. So please let us know and we'll guide you to the right place.
Okay, and then when does a fever become dangerous?
Right, so some people think my baby's going to get brain damage. It's like 103, 104 or something like that. You don't get brain damage till 108. But obviously 104 in the medical book says call a doctor right away. If it's 105, I want to see them right now. Okay. You know, things like that. But very rarely it gets that high. And even when it gets to 104, I was like, well, what do they look like? Are they drinking? Are they eating? Are they happy? Are they playful? Or even if it's 101, if they're down, it's like, okay, come in right away.
Oh,
so it's not always the number that matters. It's the overall picture.
Okay.
Yeah.
Well, thank you for clearing this up a little bit. I don't know how much it really calms us when our child has a fever.
Right.
We're still going to be stressed out, but maybe we're stressed a teeny bit less. So I appreciate your help.
But if you are stressed out, please seek help, and then we're here to help you.
Okay, good. Thank you.
Yeah.
Treating the whole family.
Yeah, that's right.
If you'd like to watch this segment again or find information on how to contact Dr. Sang at one of the 2 Sang Pediatrics locations in Fresno, log on to kmph.com and click the tab labeled Kids Health Watch with Dr. Sang.